Let's start with a really powerful idea, one that gets right to the heart of a huge challenge. For decades, healthcare innovation in Africa has looked like a series of small, disconnected pilot projects. Now, these were all well-intentioned, of course, but the problem was never a shortage of ideas. The real problem was the lack of a permanent foundation to build anything on.
So we have to shift the whole conversation. The answer isn't just another temporary project. It's about building permanent infrastructure, an engine for execution. And that's what we're breaking down today. AfriPharm Health, which is designed to be Africa's healthcare operating system.
To really get why this is so critical, let's make it personal. Imagine a child collapses at school. Paramedics rush in. They have maybe 5-7 seconds, tops, to make a life or death decision. But what they don't know is that she has a severe allergy to penicillin. Now, that's not a failure of medicine, that is a failure of data. It's what happens when a patient's history is missing at the most critical moment. And sadly, this kind of thing happens every single day.
So let's dig into the core problem here. Africa's health challenges aren't new, and they absolutely don't come from a lack of effort or good intentions. The real issue is something we call the policy execution gap.
You know, the continent has an incredible history of ambitious health goals. You can go all the way back to the Alma-Ata Declaration in 1978, then the Abuja Declaration in 2001, right up to today's goals for universal health coverage. The will has always been there, the policies have been written down for decades. But here's the disconnect. The policy, the intent, it's crystal clear, but the vehicles to actually make it happen are either broken or they just don't exist. What we have instead are fragmented systems that can't talk to each other, a total reliance on paper records that get lost or damaged, and frankly, a healthcare ecosystem that just can't execute on its own goals. And the real-world consequences of this are just severe. Good policies end up sitting on shelves collecting dust. You've got dozens of different dashboards that never connect. Payments to clinics, which are their lifeblood, get delayed for months. And who pays the price? Well, it's the overworked healthcare workers who are drowning in paperwork, and it's the patients who end up paying out of pocket for care that should have been covered. Okay, so how do you fix a problem this big? You don't launch another pilot project. You have to change the entire paradigm. You stop thinking in terms of temporary projects, and you start laying down permanent national infrastructure. And this really shows you that shift in thinking. The old model on the left, it was a chaotic mix of random vendor apps and siloed tools. The new model is an operating system. It's unified from the ground up. It's not just another project. It's a scalable platform designed to be essential national infrastructure. This analogy absolutely nails it. Think about it. Netflix didn't try to fix the movie theater business. It built an entirely new infrastructure for distributing content. In that exact same way, AfriPharm Health isn't trying to patch up the old broken parts. It is building the core infrastructure for delivering healthcare itself. All right, so if we're talking about infrastructure, what does it actually look like? Well, it's all built on a clear architectural blueprint made of 5 core interconnected networks. Here's the basic model. You see right there in the center, that's the AfriPharm infrastructure. That's the operating system, and it connects every single crucial part of the health system. Hospitals, pharmacies, emergency responders, home care professionals, and virtual care. The whole point is to make sure they all work together like a single well-oiled machine. Let's just quickly break these down. You've got the Hospital Partner Network, the HPN, which gets public and private hospitals on the same page. The PPN, the Pharmacy Partner Network, digitizes prescriptions and inventory. The EPN integrates first responders for real-time coordination. The HCN empowers professionals to deliver verified care at home. And finally, the VCN connects patients and doctors remotely and securely. Each one is built to solve a specific piece of the fragmentation puzzle. So that's the architecture. That's the what. But how does it actually make policy a reality? Let's take a look at how this system works on the ground, in the real world. Here is a perfect example of what integration looks like. Say a family member in London wants to pay for their parents' medication back home in Nairobi. They use the platform, they pay seamlessly with mobile money or even a stablecoin. Instantly, the pharmacy in Nairobi gets a notification that the payment has settled. And only then is the medicine actually delivered. All the friction, all the delays, all the uncertainty, it's just gone. And the principle behind this is so simple, but it's absolutely transformative. Money moves precisely when care moves. This one payment rail gets rid of all the fragmented, messy money flows. It stabilizes cash flow for providers and guarantees that funding is tied directly to verified care. But what about the people on the front lines?
This isn't just about data and payments. This is about liberation. It's about a nurse who can log a home visit on a tablet instead of filling out a stack of paper forms. It's about a pharmacist dispensing a digitally verified prescription. This system literally unchains healthcare professionals from all that administrative junk and lets them focus on what they do best, treating patients. Now, let's zoom out to the 30,000-foot view. What's the ultimate value here for a government, for a Ministry of Health that's trying to hit its policy goals?
Well, first and foremost, it's about simplicity and efficiency. Instead of a government trying to manage 10 different donor-funded programs, each with its own weird reporting system, you get one single point of integration. One system, one set of data. That's it.
Second, you get total visibility. A Minister of Health no longer has to wait weeks or months for manual reports to trickle in from the districts. They can have one single national dashboard that gives them a live, real-time view of what's happening across the entire country, from care delivery to disease outbreaks. And maybe most importantly, underpinning this whole thing is trust. A single, secure digital identity for every patient and every provider completely replaces the chaos of paper records. This is the bedrock, the foundation for a system where care can be delivered safely and tracked accurately, from the capital city all the way to the most remote village.
And that brings us to the final core takeaway. The conversation has to shift. The challenge isn't about writing better policies anymore. The future of African health policy is all about having the tools to actually execute those policies for everyone at scale.
And really, that's the ultimate mission of AfriPharm Health. It's about evolving from being just another policy partner to becoming the essential national infrastructure that finally makes those policies a reality for millions of people.